Welcome, everybody. As people are being brought into the webinar, I just want to welcome you and say we're appreciative that you're on. And as we're waiting to get started, if you feel like going on the chat and just telling us who you are and where you're from, that would be great. And we'll just give this another about a minute before we actually start and do introductions. So again, if you're just tuning in, if you wouldn't mind just going on the chat and maybe just saying hi and where you're from, that would be great. And like I said, in probably about now 45 seconds, we'll get started. All right, we've got some folks obviously coming in from Phoenix. That's great. Thank you. We have welcome North Carolina, Carlsbad, California, Portland, Oregon. Thanks. Welcome you guys. Charlotte, Seattle, Connecticut, people from all over. Chicago, looks like Indiana, Georgia. Wow, this is a broad group of folks here. Ohio, and looks like New York City, Louisville, Kentucky, Virginia. Welcome, Nashville. Welcome. Why, looks like West Virginia as well. More folks from Tennessee, Wisconsin. This is great. And Arkansas. Wow, we got a broad audience for you here.
Great.
Coming from all over. This is great. Cal. All right. So, yeah, more folks from the Phoenix area, and again from basically all over the country. This is great. So, for those who don't know me, my name is Kim Humphrey, and I'm the CEO, Executive Director of Parents of Addicted Loved Ones. And again, I would just want to thank you for being on tonight. I'm guessing, based on the fact that you responded to my request for your comments on the chat, that you can hear me okay. And so we are happy to have with us tonight Dr. Gary Kirkilas, and I've known him for a while here in Phoenix. I bump into him at numerous events around town, and he's got some great information to share with us. But he's also got a very interesting role that he plays with the Phoenix Children's Hospital, as well as other things that he does. And I just want to let you know a little bit about him before we jump into this. And, first and foremost, he's a general pediatrician. And again, as I was saying, his practice is somewhat unique because his office is a 40-foot mobile medical unit that travels to various homeless shelters in Phoenix. And he provides free medical care to families, and he serves as a spokesperson for the American Academy of Pediatrics. He gives commentary on trending pediatric issues in the media, and as a spokesperson, he is often called to speak on the effects of, in particular, cannabis advertising on children, pediatric opioid use, as well as advocate for more mental health access for youth. He does have four wonderful, most of the time children, is what he wrote. I love that, and four loving, almost never cats, and I can totally understand that as well. So again, I am very pleased to say that I've heard Dr. Kirkland speak on numerous occasions. I'm very impressed with his knowledge, particularly around this issue. And even though many of the people that are probably tuning in are dealing with a loved one that's already engaged in, whatever type of substance abuse, and maybe you've even used the words like, well, they're only using marijuana or something like that you know of. I think by the end of today, you're going to realize there's a lot to be concerned about regarding this topic. And that's what I've learned over the last several years. But rather than me talk about it, I'd really like to just turn this over and say, welcome again. And we appreciate you being here. And obviously, we've got a very broad audience from all over the country. So I'm sure everybody's anxious for me to stop talking and to turn this over to you. So, again, thank you so much for joining us tonight.
Well, thank you so much for having me. And I just want to make sure we had some audio visual concerns a little bit before, but I assume everyone can hear me okay. And if anyone can't hear me or if the slides are not progressing well, please just put in the chat, and then I assume Kim will reach out to me and let me know that something is wrong. But if we're
Yeah.
all systems go, I will start the show.
And one thing to keep in mind as he pulls this up and gets going is if you have any particular questions, we'll probably save them till the end. And we're planning on about 45 minutes and then about 15 minutes of questions. And if you would put those under the Q&A, not in the chat. It's easier for us to track them if they're in the Q&A. And then I'll help moderate those as we get to them. So without further ado, if you want to just put those questions in there, you can certainly ask questions of each other or of us. We are monitoring it as in PAL on the chat if you have something specific for us. Otherwise, let's just jump right in. Thank you.
Sounds good. Okay, so today's topic is trends in substance use, particularly among youth. And the reason I give this talk is because a lot has changed. Whether you were an adolescent in the 60s or the 70s, or you're an adolescent in the 80s or the 90s, the substances that youth are using, how they're using them, a lot of it has changed. And I think it's really important for doctors like myself, parents, everyone in the community to know that when you think about substance abuse, you might be harkening back to what you know and when you were an adolescent and it was more prevalent. But things have changed greatly. I mean, we can all appreciate now we have social media and the internet, but the substances they're changing as well. As our society changes, we see these changes. So this is really the point of this. And I hope by the end of it, like Kim said, you'll have a refound, a renewed interest in this, to know that all these substances are quite dangerous and they are quite different than how we might be used to them being used. Okay, so first off, I have no conflict of interest. I'm not financially tied to any institution providing any sort of care regarding substance use or otherwise. So our objectives kind of written out here is first, again, to gain familiarity with what substances youth are using. And sometimes we give these lectures where a presenter will come up and say, "Well, we see cannabis use here, and meth use is here, and opioid use is here." And it's interesting, of course, but nothing for us to bite our teeth in and to understand why. Like, why is cannabis going up and why is cannabis going down? Why is meth going up and why is meth going down? Why is fentanyl going up and why is it going down? And so to make this data meaningful, I think it's really important to take a look at why these substances are going up and down. And that brings in commercial determinants of health. So before we just looked purely at public health and what substances people were using, but we often are now cognizant of the fact that a lot of this has to do with how these things are being advertised and how they're being marketed and how the substances have changed forms, and that a lot of times dictates which substances are being used and how they're being used. And then lastly, we'll follow up the conversation with the importance of discussing these substances, and I, as a pediatrician, will discuss what my role in this whole realm is and how I interact with patients and youth. And so I know this is not an exhaustive list of substances, but these are the ones that I see most often in my clinic. So we'll be talking about vaping and tobacco. We'll talk about cannabis, marijuana. We'll talk about amphetamines, opioids, and then prevention and physician's role. If I had more time, I would love to talk about things like kratom and some of these other emerging substances that are out there, but simply just don't have time. But these are the main ones. Okay, so start off the bat, we'll talk about tobacco and vaping. And so I'll be showing these slides, these graphs, and essentially they're coming from the Monitoring the Future survey, in which they're looking at 8th, 10th, and 12th graders, and they're asking them what substances they're using. And so this is a very typical graph that I'll be showing, and it's basically polling 12th graders, so seniors, and they're asking them in the past 30 days, have they used cigarettes? And it's the baby blue line, and that's the self-reported use. The green line is that they're friends. So as you can see here, overall in the 70s, cigarette use was quite high, and then you can see now it's down trending. And again, we might see this and say, hooray, cigarettes are kind of falling out of favor. Youth don't like them, but it's really important to understand why. Why are they not being used? And why was it so high to begin with? So in the 70s, we see there 40%. So almost half the teenagers were smoking regularly. Why? Well, in the 50s and 60s, advertising campaigns came out that really pushed this sort of motif that now that you're 18, you're a high schooler, this is the rite of passage. You smoke cigarettes. And you can see this depicted with the gentleman with Lucky Strike at his high school graduation or the Choice of Young America. We also saw in the 50s and 60s this real big push to say things were healthy for you or okay for you. And that's why you have the picture of the doctor there smoking his cigarettes with the tagline, more doctors smoke Camels than any other cigarettes. So again, this idea in the culture was that this was a benign thing. We also saw some unfounded health claims, like an ENT specialist saying not a single case of throat irritation. To our eyes, this looks quite silly, but back then this was taken for it as a matter of fact. We also had dentists doing this. So, as your dentist, I recommend Viceroys. Again, this is sort of my point here is trying to show why that in the 70s we had almost half of high school seniors smoking cigarettes. But then it dropped down like it precipitously dropped down so that in the 80s it sort of bottomed out there. And why was that? Well, in 1970 we had the Cigarette Smoking Act, which basically prohibited radio and TV advertisements. That's why we don't see it on the TV anymore. And also had required health labels. And so that did a really good job because then as a result of that we see it level off from the 40s down to like the 30s, which was great. But then it picked up again in the 90s. This is when I was an adolescent. And why is that? Well, we saw a big push behind cartoon smoking cigarettes. So you had Camel Joe being a fighter pilot, a race car driver singing Christmas carols. We also saw a lot of advertisements in places where youth were hanging out. So when you go into a ball game, you saw a giant billboard for Marlboro. We also saw product placement. So when I was a kid growing up, I read comic books. Lois Lane was never a chain smoker, but in the movies she was. Why? Product placement. So all that went to increasing and bumping up smoking of cigarettes in the 90s. And that's why we see it kind of climb back up again. But then again, we had some good health policy. And in 1998, we had the Master Settlement Agreement. This essentially was the case was all these states got together and sued the tobacco industry. They said, you know what, the tobacco industry is making tons of money. We as states have to foot the bill for all these people with lung cancer, emphysema, and stroke and heart attacks, all these things that tobacco causes. We're going to sue you. And so they did. And the tobacco industry had this settlement where they said, okay, no more off-site advertising. So no more billboards or transit stops, no more cartoons in their advertisements and targeting youth, no more advertising at sporting events, and no more paid product placement in movies. They also had to pay for sort of fighting fire with fire. They had to pay for their own advertisements against smoking and helping people see that, the quite filthy habit that it is. So that leads us to now in the 90s, cigarettes has continued to drop. And in my clinic, when I'm with youth, that they say, cigarettes is it's a filthy habit. They're not smoking. It's seen in a very negative light, which is good, which is what we want. So at this point, we can kind of just slap ourselves on the back and say, great job. It's a public health victory. Smoking's out of favor. We can sort of, rest on our laurels. But if we change the graph, oh, actually, before we get there, I think it's a good time to talk about the commercial determinants of health. So essentially, what I've been discussing here is how a substance is getting picked up and used based on the advertising and the marketing. And we see this in a variety of cases. So a good example is cereals. The next time you're at your Albertsons or your Safeway, take a look at where the cereals are being advertised, where the placement are. You'll have this children's cereal at eye level and a little bit higher for kids, whereas all the healthy cereals are up on the top shelf. And it's product placement. And essentially the commercial environment is driving health, which is kind of odd to us. You might think, what does marketing or advertising or business have anything to do with what substances are being used? But actually, in actuality, it has quite a bit of an effect. So again, here, as I said before, smoking cigarettes is down. We can't necessarily rest on our laurels because if we change the graph and look at vaping, we see quite a different picture. We see cigarettes is going down while vaping is spiking up. Why? For the same reasons that we saw why tobacco increased in the past. So here you have Juul, which is the electronic cigarettes. And you can see this advertisement with a girl who looks like she's barely of the age of purchase, which is 21. And you can see how that harkens back to what we saw in the 50s and 60s, where you placed young people advertising substances. Um, in addition, now, we have to also consider flavor. So when you smoked a cigarette in the 60s, 70s, or 80s, you knew exactly what you're doing. You smelled like smoke, your mouth smelled like smoke, you coughed uncontrollably, you had to hide it, otherwise your parents might catch you. You did it in the bathroom, you were at risk for a teacher to walk in. That all has changed now with the vape device because these electronic mechanisms can have things like flavors, like strawberry ice cream. So this is an advertisement for Elf Bar, which is very, very common amongst youth. Um, they're able to use that and not smell like smoke anymore, right? So it's very easy for them to get quite addicted to nicotine because now they're not smelling like a cigarette. They can taste strawberry ice cream. Also, here you can see depicted it's a youth who looks like they're barely of the age of purchase. And so these things are quite common. They look like these little devices that are, palm sized. So I thought now, and again, I'll just stop to make sure audiovisually we're good. Everyone can see the slides, no concerns. Okay, good. So I thought now we would stop for a moment and just play a little game. If I'd like the audience to kind of just, you don't have to type this out in the chat box, but just take a look at this picture in your mind. What do you think we are looking at? Typical
I,
guesses might be, well, this is a highlighter. Well, you would be wrong. These are vape devices, and they come in a variety of flavors. And so essentially this is marketing to youth because why else would an adult need something that looks like a highlighter, right? And it comes in a variety of flavors. Can anyone tell me what this might be? If you said ballpoint pen, you're wrong. This is also a vape device. So again, I hope I'm getting across this picture that marketing, these commercial determinants of health, are completely changing how youth are using substances. Next one, you might guess this might be a Starbucks container, but it's not. It's actually a vape device as well. This one, if anyone has a child with asthma, you might think this is an albuterol meter dose inhaler. Again, you'd be wrong. This too is a vape device. And our last one, can anyone tell me what this is?
okay, that's a toaster.
You're right. At this point, we are all safe. This is still a toaster. So if you see this in your child's bedroom, you can rest assured they're just making toast. But it just goes to show it's quite egregious, right? How youth are using things. So whereas before in the 60s, 70s, 80s, it was cigarettes, it was hard to use, you got caught, the flavor was bad. We've all changed that through marketing and advertising and product development. So things are definitely changing. Okay, changing steps onto cannabis. Here is a graph that shows a lot of substances, but the marijuana cannabis is depicted in green, and it shows the prevalence. So you can see here it has dropped down in the 2000s, although I will say it's still at a high level, right? So we're still dealing around 20%, so it's still quite ubiquitous. Many youth are using it, and in this graph, we're taking a look at trends in annual prevalence amongst 8th, 10th, and 12th graders. That's kind of known. It's kind of just, well known that, it's quite ubiquitous and a lot of teenagers are using. But I want to kind of draw attention to something that I find more insidious and more concerning. So here is a busy slide, and I don't know if you can read it too carefully, but essentially what it is, it's saying trends in harmfulness of drugs as perceived. Okay, so basically they're asking 12th graders, how harmful do you find marijuana? And in the graph there, you can see in 1990 to 1975, if you told a 12th grader, how harmful is it to smoke marijuana regularly, 43% would have said that would be a bad idea, or that's a harmful thing to do. But and I would say that's pretty bad because if it's not even half. You'd hope it'd be as high as possible. Like 80% of 12th graders would say, hey, that's a bad thing to do. Maybe use them once or twice, okay, maybe fine. But if you're using it regularly, that's a bad thing. But as you can see, as the years go by 1990, it increased up to 77, which is good. But in 1991, we see it creeping back down again. So what's happening in the 2000s that's causing this? Well, this is where we're seeing the emergence of medical marijuana. It's now perceived as a medicine. And so if you can harken back to those tobacco slides where tobacco had Camel cigarettes were being smoked by doctors, this image where this is a medicine, it's not harmful, is influencing youth to see this as a less harmful thing. It's outside my purview to say whether marijuana, cannabis is medicinal. I know we have Epidiolex and Marinol. That's outside my purview as a pediatrician, but I do know that marijuana is not safe for use amongst youth, especially with developing minds. And as you can see here, youth are perceiving it as less harmful. So that whereas in the early 90s, it was 78% said smoking marijuana daily or regularly was bad. Now it's down to 50%. And as you can see now in 2023, only 30% can see that. And you can't really blame them because in this timeline, now we have recreational use of cannabis. I think up to 24 states have now legalized cannabis to be used recreationally. About 40 of them have a medicinal program available. And so all this is occurring is changing the perception of this. When I ask my patients, are they using, any substances? They'll say no. And I say, are you smoking anything? They say, yeah, marijuana. They don't actually perceive this as a drug. They see this as something that's natural and it's medicinal. And it is being advertised. And so we'll get into the advertising now. This is a picture of a billboard that I took here in Phoenix during Christmas time. And it has a picture of a Santa Claus smoking a joint. It says Happy Holidays. So youth are seeing this. Now imagine we might chuckle by this. A teenager might think this is cool, but imagine what a 5 or 6 year old sees. Santa's the biggest thing on earth to them, right? And it's smoking a joint. They're going to see this advertising like this for the next 5, 10 years. So when that 5 year old or 6 year old is 15 or 16, it's not a big jump for them to smoke marijuana because they see advertised. Santa Claus is smoking marijuana. And then youth as well. They don't see this as, they wouldn't see this in the same light as fentanyl. Well, because it's advertised. Santa Claus does it, right? So it's not a big deal. Here's another billboard that I took a picture of. It says, where does Santa get his dopest gifts? At Bud's Glass Joint. And it has a picture of Santa Claus holding a water bong. This picture was taken about 3 blocks from a high school here in Phoenix. More billboards grown by AI, things that youth might be attracted to. It's now 2026 and we have to talk about social media. So here is Instagram posts by Cookies. They're a dispensary here in Phoenix. And Instagram and Facebook do not allow paid advertisements. However, these companies can pump out just posts. So these are just regular posts, and all the company has to do in their bio is put nothing for sale. And essentially, they're just pumping out posts as you and I might put something on Facebook. Twitter or X is the only platform that allows paid advertisements, but it really doesn't matter because they can pump out these posts. And if you could lie about your age on your Instagram profile, your youth will be seeing these types of images. Another brand called Cushy Punch pumps out. They are a cannabis gummy. They use cartoons. They cartoonize their cannabis gummies to fight each other. They encourage you to send in for their swag bag, which is none other than a school backpack. They depict kids walking to school with their backpacks. The gentleman in the middle there with the orange shirt on says, how many Cushy Punches do you eat at once? This is sort of hearkening to the online trends that you see, like the spicy chip challenge. How many spicy chips can you eat at once? Or how many glasses of milk can you drink at once before you throw up? So these are sort of online images that our youth are seeing. I show you some pictures of billboards and advertisements where youth, this rite of passage sort of thing, where it's you're in college or high school, so now you're rite of passage to smoke cigarettes. Well, here you kind of see the same thing. Here's a billboard I took of the ASU Sun Devil. He's smoking a joint, and his pitchforks are burning joints. And if you're not aware, this is the normal ASU Web's mascot, and this is what they're seeing. So again, youth are being advertised to in a way we've never seen before. Here is a Facebook page post about Rebel Rabbit. It is a THC beverage. So now cannabis can be consumed traditionally as smoked. It can be consumed through gummies, and it can also be consumed as a beverage. And here we see back to school where they cross out the word school and say buzz. So again, very egregious. Youth are seeing this. Our youth are being targeted. And why? Because it's money, right? I mean, as long as we can, you don't normally advertise to a 50 or 60-year-old because they're only going to use your product for 10 to 20 years. You advertise to a teenager, they're a lifelong customer. And when you think about, again, the traditional way of using cannabis marijuana, you'd have to find it, you have to buy it, you have to roll it into a joint, you would smoke it, you might smell like it, you'd cough uncontrollably, you'd have to worry about getting in trouble with your parents. That's all changing now, right? So we have products like that Cushy Punch that I was mentioning. They have flavors like blueberry or watermelon, sour apple, lemonade. And kids can get themselves in trouble because when you're smoking marijuana, you feel the effects quite quickly, right? Where if you're with the edibles, it takes some time. And so, a youth might chew a sour apple and not feel anything for a half hour and say, oh, this stuff doesn't work, and take one or two more. And now they've consumed like 3 or 4 joints worth. And then they end up in the emergency room because they're, totally discombobulated, throwing up, can't, don't know right, where they are, nauseous, totally intoxicated by this stuff. So it sets up a really, really bad situation. And then we see some more egregious things like Stony Patch, which is Sour Patch Kids. So these are products that are made to look like normal candy that you would buy at perhaps your grocery store, but then you get them like this, which is a THC product. Also Doritos. And if you're in the medical field, you work in the emergency room or the urgent care kids, a teenager might bring this in their backpack, right? And then their 5 or 6-year-old sibling might get this and think, oh, Doritos, great, and then consume this bag. And this happens, and kids get themselves into trouble. Same thing here with chocolate Stonios, again, a THC product. And all this is occurring right at the time where THC is increasing. And so now we have a situation where cannabis is being advertised. It can be purchased in a licensed facility. It can be used as a gummy with flavors. And the THC levels are rising. So this is sort of the perfect storm where most people, when they think about cannabis, they might, harken back to the 60s or 70s when cannabis was only, the THC component was only 3%. It produced mild euphoria. And rightfully so, you might think, well, what's the big deal with that, right? But now that's a completely different beast now, where now things are up to like 16% THC or concentrated pure THC, and kids can get themselves in really big trouble. So it's sort of like the crack cocaine of cannabis now, because they've taken something that was only 3% and concentrated it to its like a very high percent, where kids can become addicted and nauseous and intoxicated with this quite easily. I included this slide just because sometimes parents are concerned about where cannabis is coming from. So they do get it mostly from their friends, who, you only need to have one family member, an aunt, an uncle, or a cousin who's 21 and can purchase the product legally, and then distribute it to their siblings or friends and peers. They also get it at schools and parties. Some of them have even claimed to have bought it from a dispensary here in Arizona. Perhaps they're using a fake ID. I'm not sure. But those are sort of the breakdown of how kids are getting their substances. Okay, so now switching gears over to amphetamines. So I know a lot of times when we think of amphetamines, our minds immediately go to methamphetamines, which would look like this, and we're all familiar with the methamphetamine's effect on dental care. But I also want to encourage parents and family members to really think about the fact that that's not the only case with amphetamines. We also have to think about Ritalin, methylphenidate, or Vyvanse. These are all medications that we use for ADHD, and they can be abused as well. Perhaps not in the same way, but they can be abused as well. And so here's a graph sort of showing how we're looking at methamphetamines. Now, if we compare this to cannabis, which was at 20%, these levels are much lower. So we're looking here, self-reported use is below 5% now, which is good. But still, this substance can cause havoc on people's lives. And so let's take a look at sort of why this is sort of occurring. So previously, back in the 70s and 80s and 90s, the way people would make methamphetamine was by the raw product of ephedrine. And so in 1996, they passed the Methamphetamine Control Act, which limited drug dealers' ability to buy these products, these medical grade ephedrine byproducts or precursor products. So we see that actually helped a lot in the 90s to bring that level down. Then it picked up again in like 2010 and 2012. And we had additional acts where now in the late 90s, pseudoephedrine, which is another precursor to methamphetamine, had to be behind the counter. And that's a really important thing. So when we're talking about other substances that are purchased, can be purchased legally, like kratom, we want those products to be purchased behind the counter so they can't be shoplifted or someone kind of just grab it and put it in their pocket. We always want this behind the counter so some sort of identification can occur. And so this is one of the lessons we learned from with methamphetamines. When Sudafed was put behind the counter, and you had to produce a driver's license, it really reduced the amount of the substance that could be filtered to drug dealers to create the dangerous product in the first place. And so the level, if you can, and it's kind of hard to see, but very close to the 2023 mark, you can see that level is sort of going down, which is what we want to see amongst youth. But we're having a little bit of a leveling off. So meth has a little bit of resurgence depending on your region of the United States that you live. Okay, so on to opioids. So here is a graph showing opioid use amongst 12th graders, again, 30-day prevalence. Baby blue line is the self-reported. So again, these levels are much lower, even lower than methamphetamines. And you can see sort of leveling off and staying off at less than 0.5%. However, why do we see that going on? Well, if you're going to use heroin, you're going to have to buy it, right? You're going to have to put it. It comes in a crystal form. You have to light it on fire to make it sure it's a liquid. You have to get your hands on a hypodermic needle to draw it up. You're going to need to get yourself do a tourniquet yourself and to inject it into yourself. These are all things that youth do not want to do, right? I mean, this happens, of course, with youth, but these are all things that youth aren't exactly lining themselves up to do, and that's a protective factor. If that drug has to be done in an unpleasant way, they're not going to use it as much. Just like like smoking cigarettes, they don't want to smell like smoke. That's good. But if we make it a vape and it can smell like, candy apple, that's a bad thing. And so the heroin had this was a great a way to get a lot of youth off of using it because it was such a difficult procedure to use. But if we could change that, or if the drug dealers could change that and suddenly make heroin in this sort of form, in oral form, and we can make them colored like this, we would potentially see more youth wanting to use our product. And that's exactly what's happening. So now fentanyl, as I'm sure everyone is aware here, is a leading cause of death amongst youth. And in fact, it's one of the leading causes of death in Arizona here as a result of fentanyl sort of being funneled through our state, through the rest of the United States, unfortunately. And so a little bit about fentanyl. Essentially, it's called M30s. My patients will say, yes, I'm taking blues, I'm taking M30s or M's. And essentially, this is exactly a copycat of oxycodone. The drug cartels have the printing press or the pill press, so their product can look no different than a normal oxycodone, but has fentanyl, which is like 100 times stronger than heroin. And so you can see why when we change the graph to opioids other than heroin, you can see that level is much higher. So back in the early 2000s, self-reported use was higher than 5%. If we compare that with heroin to non-heroin, on the left there, on my left, I'm sure that's probably on your left as well. You can see those levels are less than 0.5%, whereas fentanyl in the oral forms are much higher because of commercial determinants of health, the way these things are marketed, advertised, not necessarily advertised in this case, but the way they're marketed and the way that we use them to really drive youth use up. A little word on some harm reduction as a physician. Narcan is an excellent medication in case of an overdose. I was a part of a push to have Narcan installed in schools. So, in all K through 12 schools, if someone eats a peanut and they have an allergic reaction, well, we have an EpiPen there waiting for them to save their lives. And so we thought a good idea was also to have Narcan in case someone has a pill of fentanyl that they either decide to smoke or ingest while they're at school, or perhaps, a child finds this on the playground. We have this Narcan available. And so many states are doing the same thing now too, where their public school systems will have Narcan available in emergency uses. Here's just an overall grouping of all the substances that youth are using. And you can see for most substances, as we look from the past 4 to 5 years, most substances are going down, which is great. This warms my heart to know that most youth are not choosing to use substances. But again, alcohol, marijuana, and vaping are the big sort of big ticket items that people are using. We often talk a lot about what substances youth are using, but I think a side topic that we often don't talk enough about is whether people are using this under the influence. So here we have a graph of what people are using in the various years, whether they're using this as riding or driving. As you can see there, a lot of youth aren't the ones that are necessarily driving the vehicle when they're under the influence. However, they are often finding themselves in a car that someone is using these substances. And when you talk to patients or you talk to loved ones, making sure that they know, of course, not to use these substances, but also not to be in a car when someone's using these substances as well. But talking while driving and using social media is the biggest distractor for kids as it might be expected. So that's also another, not a substance use related topic, but a good motivation for people to talk about with their youth. So prevention. So communicate. They say in the real estate world, location is the biggest factor. Well, communication is the biggest factor. So parents, dentists, doctors, we all need to have these what I call awkward conversations. I know a lot of times people don't want to have these conversations with their loved ones, but they really do need to do. They need to be happening because if we don't talk to them about it, other people will. And so my advice as a pediatrician is to have these conversations while they're in the car. It's a great way because you're not facing the youth. You're both your direction is forward, so it's less of an interrogation atmosphere. And when it's less like an interrogation, kids are most likely to open up. This, of course, is probably more applicable to someone who hasn't started using, or if their use is just limited to experimentation. This is a good way to go about it. Plus, when you do these conversations in the car, you have a captive audience, so it's not like your teenager can run away to their room or just say they don't want to talk about this anymore. So having it while in a car is a really great way to do this. And I also encourage people to make the topic about substance use in general. That helps them to get them opening up. I encourage you to do this early on, so because that gets the lines of communication open. So an example of this is, you might start off with, I hear a lot of youth are using cannabis. And they feel like it's like a normal thing. What are your opinions on this? Get them to open up that way, as opposed to your lead in being, are you using cannabis? You shouldn't use fentanyl. You know why? Because it's really dangerous. If you first, even though it's important and it's true, right? But if you open it up about the substance in general and just get the kind of the juices flowing where you can have open lines of communication about this, it makes that second or third conversation a little bit better, where they can feel they can be open up to you, where they can say, hey, one of my siblings or one of my peers is using, I'm a little concerned about it. So just some basic advice on how to sort of broach that topic. And again, it's not a one and done thing. It should be done regularly and use popular media or just everyday lifetime occurrences as a motivation to talk about this. So in my family, when I have my young ones with me, if I'm driving down the street and I see someone on the side of the street smoking, I use that right then and there as an impetus to talk about why smoking is bad. I'll say something to the effect of, see that person there, I feel really bad for them that they're smoking a cigarette. That's a really bad decision. It has all these bad health effects. I really feel bad for them. So using things like that, or unfortunately, if there's like a motor vehicle accident or someone gets expelled from school, using these sort of things as an impetus to revisit this topic. And hopefully, if it's discussed enough, it doesn't become awkward. So I, as a pediatrician, a lot of times parents will ask me what my role in this is, what goes on when I see patients. So whenever a patient comes in for a well check and they're an adolescent, I always talk about substance use with them. And a lot of times parents want to know, will I ever find out about this? Because sometimes the parent isn't in the room. And so there is actually a law that states that a provider may break confidentiality with their patient if they feel that their life is in danger. And in fact, they have to break confidentiality. So if I know of a patient who's using a substance and I feel that their life is in danger, or the way that they're using the substance puts their lives in danger, I'll partner with my patient and say, hey, look, I'm really concerned about your life. We need to talk about this with your mom or your dad, because I think your substance use has gotten to the point where your life might be in danger. But I have to carefully weigh that, because I know that, let's say I have a patient that says I'm vaping. Do I necessarily break my confidentiality with the patient then? I may or may not, because once I do break that confidentiality, I'm essentially severing my relationship with them, because they're never going to come back to me again. So if they're vaping, and I break that confidentiality, they'll never come back to me and tell me, hey, now it's progressed to the point where I'm using fentanyl or cannabis, because I'm not to be a trusted person. So I have to use that very judiciously when I'm going to break my confidentiality. And so when you go to the doctor, and I encourage everyone to go to your pediatrician regularly, you might see something like this, or your youth would see something like this, where they're basically essentially asking, how often are they using substances? And any of those who are using monthly or weekly, those become referrals to a substance use referral. And Arizona law, I'm not sure about other states, but Arizona law does allow youth to who are under the influence or experiencing withdrawal, they can go and check themselves into it for emergency care, which is a good thing, because we want them to get care done. Any ongoing care is not permitted. So at that point, a parent would have to then consent for that sort of treatment. So those are all my slides, and here's my references. I think we are at around 45 minutes. So that's my presentation. I hope it was informative and it wasn't too heady into the weeds with data, that I provided enough explanation why the data is going this way, and to really drive home the point that our perception of substance use back in the 60s, 70s, 80s, and 90s is completely changed. And in actuality, it's sort of bad news, because it makes our job harder, because these substances are being advertised to. Substances are sweeter and taste better, and kids are seeing it more often. And as a result, they see it as less harmful. So with that, that's my presentation. And I guess I'll open up to
Yeah.
Kim to moderate any questions.
Well, I really appreciate it, and I every time it's really great information. So thank you. I know that many people in here are still dealing with. They may have a child that's already involved in substance abuse, but they also have, some of them have grandkids, and some of them have other kids, and so a lot of this is good information, and it also spills over, because it's not a big leap from being, 14, 15, 16, and then there's 18, 19, 20. And one of the recent things I was talking to somebody about, they called me and said, "Hey, I've got it was either 18 or 19-year-old, and I think there's a substance abuse problem." And I said, "Well, describe what's happening." And they said, "Well, they said first of all, he's skinny as a rail, he's very hyper, he's that's not normal, and that he's not only been losing weight, but he's got these like paranoia and manic things and all that." And so, of course, my initial reaction after law enforcement for 32 years and typical understanding, I'm like, well, sounds like amphetamines, sounds like, methamphetamines probably. And I said, "Have you had him drug tested?" And they said, "Well, we're taking him in, but I'm very concerned and all that." I'll just jump to, they called me later and they said, "Well, we had him drug tested. There's no methamphetamines. He had high concentration THC." And it was obvious that that had happened. So I wondered if it just didn't seem even logical. You expect to see somebody having the typical what you see in the movies when they, smoke marijuana. Could you talk just a little bit about that? Because I think it was, way up there in the concentration level, to the point where I don't even know if there's a lot of research on how that affects people.
Yeah, I mean, that's a really good point, because having in a sort of strange way, the good old days of the 60s and 70s, just having it being in a more natural form, 3% THC, and having to smoke it was protective, because it would be a rare thing for someone to go and smoke 3 or 4 joints worth at a time to get those high THC levels that a child or a teen or a young adult can do right away with just popping 5 or 6 gummies. And so we're seeing all these unintended consequences of this, where kids are getting themselves in quite big trouble. That's also kind of why we also see these things like cannabis-induced hyperemesis, where kids are constantly vomiting. The amount of THC is just off the roof. And due to some of these biochemical reactions, they can't stop vomiting, and there's no medications that we can use. So kids will go through this and they'll lose tremendous amounts of weight because they can't keep any food down because they're so nauseous beyond measure.
Mm.
We also see these things like cannabis-induced psychosis, where instead of becoming euphoric with their cannabis, they're becoming delusional to the point where they're psychotic. And again, I think I mean we need more science behind it, but I think it sort of harkens to the fact that the THC levels, the body was never meant to ingest this high amounts of THC, where you got 16% of THC or 100% of THC if they're consuming or smoking pure concentrates. So yeah, that story of someone who's becoming very delusional and paranoia and losing weight. Unfortunately, it's common now that we have this high concentrated THC in forms that are quite pleasant to consume.
Yeah, so it's pretty clear that, you can't just make assumptions about, when you're seeing this, that it's, quote, is this, or in this case, like the psychosis and all of that stuff is clearly can even be caused by this high levels of cannabis or THC in their systems. And that just harkens to it's part of a question that somebody asked, but it's also just very common. And from what I've seen, and I'm guessing from what you can talk about briefly, is that I also have people that will say, well, I don't think I have too much of a problem because all I ever see them doing is vaping. So they're just vaping, and they're making an assumption that they're vaping nicotine. And the
Mhm.
reality is what? They could be doing.
Yes, I mean the vape devices they can be there are settings that there could be no exhaust at all, and those cartridges could in fact have nicotine, yes, or it could have liquid THC. So that, you can't tell what's in those devices. And a lot of times, as you saw, these vape devices can look like anything. And they can have anything in them. So yeah, that's a correct assumption that perhaps it isn't just nicotine. It could be something else. And nicotine is quite addictive. So kids can get themselves into quite a big trouble that way too with just pure nicotine vaping as well.
Yeah, and then I'm assuming also just the whole issue of, many of these are adulterated, so they may have thought they were getting one thing and they're getting, potentially even fentanyl or other drugs in there. I'm assuming you
Yeah.
can pretty much put
We
anything in there, right?
Yeah. I mean, we had a couple of deaths actually as a result of vaping cannabis because they were using a vitamin E as one of the substances in there for the flavoring, and that had this really bad reaction to the lungs, where the lungs were getting this high level of irritation and inflammation. That has been since removed, but yeah, I mean, you never know what you're getting inside of those.
Yeah, a couple of quick questions, just kind of factual questions. And one is, when it comes to like Narcan, and I know I ended up, picking up these at different events and things like that, but then I also noticed they have expiration dates. And we have a question about, if it's expired, like less than a year or something like that, or they still use them, or is it, what's really happening? Is that real, the expiration dates?
That's a good question. So uh, the reality is the medication does not truly expire, as in like let's say it expires on February 18th. On February 19th, that medication does not become 0% effective, right? But at on February 18th is when the effectiveness starts to decline. So if you wanted the full strength Narcan, you'd have to be used before February 18th. After February 18th, it might drop down to like 95% effective or an 80% effective, where the medication starts to degrade and become less effective. But it's not like a one-stop done. It's not producing an effect anymore. So being that it is a life-saving material medication, and you have a high suspicion that it would be used. Yes, I would want to get a new Narcan dispenser for that specific purpose. But the one that you have that's expired, I would keep it around. Maybe put that one in your car or have it around someplace else. Because it's still useful. I get myself in sometimes a hot water with this because essentially, like if you did keep that one in your car and that was the only one that you had and you used it, and let's say it's been sitting in the sun for a year or two, and now it's like it's only 50% effective, and that was the one that you had to use, and now suddenly you're using a medication that's 50% effective. that would be an unfortunate case where it was used and didn't save a life as a result of it. But yeah, that's my long-winded answer.
Yeah. Well, and it makes sense. I mean, obviously the best answer is, try to make sure it's up to date. But when it comes down to just, you mentioned talking to your kids about this. Is there a recommended age you start talking about this?
Yeah, I mean, like you could start around 4 or 5. One of my other presentations, I talk about my 4 or 5 year old. We were walking in an outdoor mall, and at the time, she really liked bunny rabbits. And in this mall, this outdoor mall, there was a T-shirt with the Playboy bunny logo, and it had the little rabbit there. And my daughter said, "Daddy, look, there's a rabbit. Can I have that T-shirt?" And I was like, "Oh my, like, what am I going to do with this, right?" And it really hit me that at 4 or 5 years old, they're able to perceive these things so clearly. So if a 4 or 5 year old can clearly see the Playboy rabbit and know what exactly it is, I think it's really behooves us that yes, when they're 4 or 5, you need to have these conversations because they're already seeing advertisements for cannabis, right? And they're seeing it and they know what it is. Starting at those conversations young is really important. Now, you don't have to go into the weeds with it when they're 4 or 5, like saying, you could die from this stuff. You could keep it very light, saying like smoking cigarettes is bad. It hurts our lungs. We don't do that as a family in our decision. And when you see someone doing it, you make mention of it. But yeah, to answer your question, 4 or 5, and then as they get older, when they're in like middle school, grade school, then you can get more into the weeds about the health effects.
Sure, sure. And back to kind of uh, smoking, like for example, my sons were involved in smoking heroin, and essentially, heating it up and then, that type of thing to get the effects without having to inject it. Then later, they were involved in intravenous use of it, but that in interim was that they went that direction. Can they do that with even with vapes and things like that, or is it mostly just the typical?
Yeah, so the sort of the bad thing about the vaping is that it's already a pleasant enough experience that doesn't need to be improved upon. I don't know of any other ways that people are vaping things besides just the normal way of vaping products. Um, yeah, so as far as I know, I'm not aware of any other new
But
ways.
they can they have heroin in a vape? I just wondered. I've never.
I assume I assume that you could. I assume that you could. The problem would be you'd have to heat the heroin up to get it to the point where it's a liquid level.
Sure.
I don't know if
Yeah.
it would stay that way, but yeah, I guess it would if you immediately put it in that way that I assume you could, yeah.
Yeah, I wondered about that. That's interesting. So, um, any thing about CBD um, being sold with Delta 8 or 10 THC? Any comments on that?
Yeah, so I think in October, one of the federal bills came out that made Delta 8 products illegal. It was a closing of a loop of the Farm Bill. Yes, if Delta 8 is very much popular amongst youth in states where they can get it. Um, CBD as well. CBD doesn't should not have any Delta 8 or THC, excuse me, products in them. CBD is thought to be a more medicinal or embodies the medicinal component of cannabis. Don't get a whole lot of youth using CBD, except for with one exception, my student athletes will often use it. And I will also, that's a good point to say. Student athletes are often using cannabis with the means that this is helping them with their sore joints and pain. So I'll have some high school baseball players, high school football players who are getting good grades, and you wouldn't be pegged to be someone that was using a substance regularly, but are in fact using cannabis. And they mentioned that their entire team uses cannabis gummies for pain, with the aches and pains, and that's sort of being emulated because a lot of professional football players and NBA players will be on Instagram or on podcasts stating that they use cannabis for aches and pains. But yeah, Delta 8 does is quite popular. But with the federal bill closing the loophole, hopefully we'll see it not being sold as much in vape shops and things like that.
Well, and you mentioned earlier, and we didn't have much time, and we're coming down to the end here, but maybe just say something about using kratom and the issue with that, because that is becoming a big issue for people, and a lot of people are very concerned because it's pretty readily available, and a lot of people are touting a lot of things about it, and
Yeah.
so.
So kratom is a plant is available as a plant. It's come from Southeast Asia, and at low doses, kratom produces some of a stimulant effect that would be similar to cocaine or caffeine, but with some euphoria. At higher doses, it becomes more like an opioid, so more like fentanyl, heroin. Is very readily available and very readily advertised, almost in every vape shop or gas station. You can come across this. It is being touted as the safer version of fentanyl. So for people who are using fentanyl or heroin, it's a good way for them to get off of it. I mean, if someone's using those substances, they need to be seen by a substance use specialist. I don't think kratom is kratom being bought from a Circle K or from a vape shop is the answer to helping people with a very serious issue. But yes, readily available, highly addictive, can cause overdoses, can cause addictions in the same way opioids can do because they're using essentially the same receptors that opioids do. Here in Arizona, where there's some attempts to make it illegal, and attorney general offices are getting complaints all the time about this. So I think this is sort of the next big health policy thing that we'll be seeing. But yeah, I've written articles about it. Healthy Children, the AAP article I wrote. I can send that to you, Kim, about if anyone has any further questions about Kratom.
Yeah, and one resource out there that we refer people to sometimes is Smart Approaches to Marijuana, that
Yes.
organization. And within them, and just for those, because we had some questions in here on people asking about legislation and things like that. Underneath the Smart Approaches to Marijuana, they have an organization called PAN, which is the I think it's Action Network. And essentially, their goal is just to get parents together to advocate regarding these kind of issues where these bills are coming up, and trying to, and so they put out all kinds of information to tell you, hey, this is what's going on, and if you're interested, you can go and try and influence your legislators to support or not support something that will help curb some of these issues. And obviously, we had a lot of questions in here, and there's, this is clearly a topic that is affecting a lot of people. And I think back to my very beginning, I said, I can't tell you how many times I hear people say, well, right now it's just marijuana. That's all so it's like, and almost like it's like, oh, it's no big deal. Like
Mhm.
I'm not dealing with, oh, like fentanyl or something like that. So with that as a backdrop to end this, do you have any last words about this? Anything for parents out there just to kind of wrap this all up?
Sure. Yeah. I would second the recommendation about smart approaches to marijuana and their Parents Action Network. The reason being is that legislators they have lobbyists in their ear all the time, and then and parents coming forward is like it's like amplifying the voice. So I highly encourage people to join SAM or Patients at Network. I highly encourage people to email their legislator. I spend a lot of time at the Capitol, and a lot of these bills that come forth to make substance use more restrictive or to prevent advertising and prevent the availability of these products, they're coming as a result of a angry parent or a sad parent emailing their legislator and saying something needs to be done. My son or daughter had spent the night in the emergency room because of something. Please do something to make this stuff stop. So I highly recommend that. And then to the second point regarding, it's just cannabis. One, that argument was probably valid in the 60s and 70s if your youth was using cannabis because it was only a THC level of 3%. But you can't have that argument now because the THC level is much, much higher. And then two, if a person is of their social situation as such, or their mental health is such that they're seeking to escape reality through substances, or they were experimenting and they were addicted, there's nothing stopping them from taking the next step to something else. And if you're in those circles that are using cannabis quite frequently, the circles that are using meth, the circles that are using kratom, the circles that are using fentanyl, those circles are going to align eventually. And so, yeah, that sort of argument, it's just cannabis. doesn't really hold a lot of water now in 2026, and it's just a matter of time where those circles sort of collide, where they're going to meet someone who's also using kratom or who's also using fentanyl, or opium or cocaine or one of those other substances. So I would leave with the fact that yes, we can't just say that anymore.
Well, again, I just want to say thank you. This has been enlightening. I learned some new things tonight as well. And we had lots of great comments and a lot of people saying on here how much they appreciated your presentation. So
Well, thank
thank
you.
you for taking the time. And for those that are out there, thank you for joining us here on this Recovery in Action series. You know, we're looking for other topics and things that we know that will hopefully be of interest to you. And of course, if you have anything in particular you want us to look into, you can always let us know here at PAL. And again, Dr. Kirkilas, thank you so much, and we really appreciate you. And you're doing some great work. And by the way, that whole work you do out there is truly amazing. To see that vehicle traveling around and realizing that people are getting the health care that would be really, really almost impossible for them to get if it wasn't for individuals like you. So thank you for all that you do. Really
Of
appreciate it.
course. Thank you for having me. Thank you.
Thanks. And to everybody else, have a wonderful evening. And again, thank you for tuning in, and we'll see you at the next one. Thank you.